Bipolar disorder only affects about 1% of the global population, but those that are affected by it can face a lot of hardship. Bipolar is a psychiatric disorder where the individual with it experiences recurring large mood swings. The disorder has also been referred to as manic depressive illness. It is estimated that 73 to 93% of bipolar disorder is due to genetics. When it comes to environmental factors in bipolar disorder, it is important to understand that the different factors, both environmental and genetic, often interact and overlap. If you have reason to be concerned about you or a loved one's risk for having or developing bipolar, you have come to the right place. Here at our company, we run a genetic test that checks for 35 genetic variations in specific genes that are attributed to the risk level of bipolar disorder. These 35 SNPs can impact the production of proteins in your body and consequently impact your personal risk for bipolar. Here is an example. The gene DRD2 encodes for the protein D2R. When a SNP impacts this ability to encode D2R, it can provide the initial trigger in the pathogenesis of bipolar disorder. A lot of the genes that impact bipolar disorder are important to brain function. We will go into more detail about specific SNPs with other genes next. One specific SNP I want to address that we will test for is RS1316660. This SNP is related to the ADCY2 gene, which encodes an isoform of the aldehyde gene, which is uniquely expressed in the brain. The GG version of this SNP is normal and does not affect risk. The GT and TT versions are associated with bipolar disorder, with the risk being greater with the TT genotype. The risk is greater because these variants from the normal encode for a missenese mutation in a transmembrane domain of the protein. Another SNP that we looked into was RS7757037, which according to SNPpedia is associated with the FKBP5 gene. This SNP is associated with bipolar disorder, however, the variants actually lead to a decreased risk of developing bipolar disorder. The normal allele of this RS is GG, which has normal risk. The variance AG leads to 0.68 less risk of getting bipolar disorder. The AA variant leads to a 0.63 less risk of getting bipolar disorder. The FKBP5 gene influences glycosyl function, mediated by a complex formed with the glycosyl receptor. This also affects anxiety and mood. A benefit for genetic testing for bipolar disorder is that doctors can use your genetic information to prescribe the right medicine so that your body won't have an adverse reaction to the treatment. It is estimated that the heritability of bipolar disorder is between 60 and 80%. So if you know of a close relative that has bipolar disorder, this is the test to take to determine if you have any risk alleles. A limitation of genetic testing for bipolar disorder is that despite knowing about genetic markers that can affect the chances of having bipolar disorder, there's no specific gene marker that can cause bipolar disorder specifically. Essentially, understanding all the factors that lead to bipolar disorder is complicated, and there are many factors at play. Another risk of going for genetic testing is that it does not predict the future. It could give you a negative or positive result, and you could have the opposite happen to you. When it comes to genetic testing, there is also an ethical side to be considered before the test is performed on someone. While genetic testing provides many pros, unfortunate results can be harmful to those who receive them. Therefore, people should consider what testing positive for a genetic disease could do before they take the test. Both emotional and financial burdens are commonly placed on someone who tests positive for a genetic disease after testing. When a patient tests positive, they can be overrun with emotions under new diagnosis. Financially, the improvement of genetic testing has greatly decreased the costs for tests themselves, but testing positive for a genetic disease on a test could create a huge financial burden. For example, a family may have to pay for more tests for their children if a parent tests positive for a disease to make sure the disease has not been passed down. Privacy is also an issue people may be concerned with because there is the possibility of their information being sold to third-party sources or the government.